Right, so I think one of the things that we've taken away from today is how busy it has been and how much there has been to talk about, and the fact that we kind of, in the last few minutes, suddenly frantically scrambled together some thoughts to give back to you. So as probably with most of the groups, we went through what the current situation was, what needed to, well, we then jumped to what we wanted it to be like, which Deborah will talk about, and how we'll get there. In terms of how things currently are, we felt that there was a real lack of communication and integration between services, which was a real problem for a lot of people. And also a disconnect between the rhetoric and policies that are out there around how mental health should work, or mental health provision should work, and the experiences of service users and people with lived experience in the room. As probably most of the groups would also feel about their areas, the key themes underpinning that were that the services are underfunded, overstretched, and also there was a lot of discussion around them not being culturally competent as well.
Just what does culturally competent mean?
I was hoping you weren't going to ask me that. Understanding the people that you're working with and their diversity, really. So,
That's exactly.
yeah, okay. I don't need to go any further then.
Good job.
As I said, Deborah will talk a bit about what our kind of ideal mental health services look like, but after that we had to come up with some points to get from where we are to there. Some of the main ones that we came up with were that patients and carers need to be involved in commissioning and design of services, and that needs to be more than just consultation. It needs to be real co-production and co-delivery probably as well. We need to, because of that co-delivery and for a number of other reasons, we need to maintain and grow our voluntary and community services because they provide a lot of support around resilience and around prevention. Mental health and physical health need to receive parity of esteem. So they need to both be thought of as similarly important.
Can I hold you to one more, and then I might come back to you this time?
There is only one more, don't worry.
Perfect.
Which is that we need to make steps to join up services. Because as I said at the beginning, it's just not joined up enough.